Well, good afternoon, and thank you for joining us here in the Capitol today. With me is Dr. Alexia Harrist, State Health Officer, Robin Cooley, Director of our Department of Workforce Services, and Josh Dorrell, CEO of the Wyoming Business Council. I wanted to make sure we covered a few topics, but let me begin by saying the coronavirus is a very serious threat to all of us, and how we address it is incredibly important. I have said over and over again, it's important to stay home, make sure you practice good hygiene, go to the store only when you need to, and go in small groups. But I do want to speak a little bit about testing and the resources we are directing to slow the spread of COVID-19. I also want to talk about the resources that are available as we work to protect people's livelihoods and support the businesses during this difficult time. As of this morning, we are up to 221 confirmed cases of COVID-19 around the state, with the largest number confirmed in Teton, Fremont, and Laramie counties. We have seen 33 hospitalizations to date, a cumulative number, and some of those hospitalized have been released. While these numbers may not seem large when compared to the other astronomical numbers you're hearing from other more populated states, it is critical and crucial that we not minimize the impact of this virus or the impact that this virus continues to have on our state's healthcare system and our medical providers. To ensure that we have a clear view of the statewide impact of this pandemic, the Department of Health is communicating with our hospitals daily. They are carefully tracking and monitoring our statewide bed capacity. We are particularly focused on places in Wyoming where there are the most confirmed cases and the healthcare facilities are most impacted. I want to say a quick word about modeling. We are working to align and make our modeling process work better. The Department of Health is looking at that very carefully. We have seen that there are some differences in our numbers and those that are being reported on some sites. We'll get more information for you on that soon. On Monday, we delivered 3,900 sample collection kits assembled by the Wyoming Public Health Laboratory across the state. Their work on this has been absolutely incredible, and I want to thank them for their long hours and the diligence with which they are pursuing this incredibly important task. This is by far the largest delivery to date. And this will help support statewide testing, but we do remain challenged by a continuing shortage of testing materials at the state laboratory. We also share some concerns around the state. Yesterday, I assembled a conference call with all the pathologists in the state to get a better assessment on testing supplies that are necessary. I want to say that today I signed a letter requesting a disaster declaration for the state of Wyoming and the Eastern Shoshone and Northern Arapaho tribes. This declaration provides the opportunity for assistance from the U.S. Army Corps of Engineers for construction of temporary medical facilities if needed. This follows on a conversation I had with Brigadier General Peter Hemlingser some couple of weeks ago, in which I had a better understanding of what they could provide in terms of resources. It also opens up our opportunity to receive additional federal resources and services for individuals, including disaster unemployment assistance, legal services, and case management. I'm pleased to report that more than 260 out-of-state physicians and physicians' assistants have signed up to provide care to Wyoming patients. And the Wyoming Board of Medicine is working to speed reactivation of licenses held by retired Wyoming physicians and physicians' assistants who want to be of help in this incredible time of need. We are also seeing increased utilization of telehealth thanks to collaborative statewide efforts. In the past month, the Wyoming Telehealth Network went from 500 telehealth licenses to 3,000, a number that doesn't include telehealth providers from our two largest medical facilities, Cheyenne Regional and the Wyoming Medical Center in Casper. What I will say, this has allowed more of our healthcare providers to provide services to patients in their home, preventing them from being exposed or exposing our healthcare workers to potential illnesses. And I also want to make a comment on how important this has been for mental health as well, as we've seen this pandemic wind its way. I now want to introduce Dr. Harrist to speak a bit more about data and current recommendations. Dr. Harrist.
Thank you, Governor Gordon. I'd like to share with you some updates from the Wyoming Department of Health. As most of you know, the Centers for Disease Control and Prevention, or CDC, now recommends cloth face coverings in public settings where social distancing measures are difficult to maintain, like grocery stores. This new recommendation is based on recent evidence that some people without symptoms can still spread the virus. Cloth face coverings can be purchased or made at home. Medical masks, such as surgical masks or N95 respirators, should be reserved for healthcare providers providing patient care. It's very important to understand that wearing a face covering is not a substitute for social distancing. We still recommend that people stay home and away from others as much as possible, and to stay at least 6 feet away from others whenever possible when you do have to go out. I'd also like to introduce some new information that will be available on our website this afternoon. The first will be rates of COVID-19 infections in each county by population of that county. The second will be probable cases in each county. Probable cases are people who have the symptoms of COVID-19 and who have had close contact with a laboratory-confirmed COVID-19 case, but who aren't tested. Because we know that not everyone can get tested, including probable cases will give us a little better idea of how much COVID-19 is in our communities. At the same time, we continue to know that there will be more cases than can be counted as either confirmed or probable. Finally, I'd just like to clarify some laboratory testing information. Last week I spoke about the testing priorities for the Wyoming Public Health Laboratory. Whether any individual patient requires testing is determined by their healthcare provider. We aren't telling providers that they can't test outside the priority categories. We are just asking them to send those samples to other laboratories so that our lab can continue to provide testing for priority patients and situations. Thank you, Governor.
Thank you, Dr. Harrist. And I have continued to emphasize that our citizens need to stay at home. You heard that at the beginning of this message, and you'll hear it a couple of times more. We want to make sure that we avoid gatherings. And I know on this Easter weekend how difficult that is. And I want to share a brief letter from Bishop Stephen and a couple of paragraphs in the bottom that kind of indicate how critical this issue is. An essential value behind, he's talking about the way that Catholic Church will be dealing with Easter services. An essential value behind our decisions is solidarity. We are obligated to do all that we can to help prevent the transmission of COVID-19, especially to elderly and people with underlying health conditions. Solidarity requires us to act to prevent any person from being infected. At this time, public gatherings endanger those in attendance, who in turn could infect others. We need to consider the common good of all people, not just our fellow Christians. We must be co-responsible citizens. And while ceasing public religious service is a drastic measure, it will mitigate the transmission of COVID-19. This is an essential way of loving our neighbor. Initially, Italy closed the churches, and then pastors had outdoor masses. But bishops and police told them to stop. Those pastors wanted to feed their people spiritually, but the result was that more people were exposed to COVID-19 and are dying. By April 6th, the death toll in Italy was 16,000 people, including 87 priests, a number of doctors. In the Diocese of Bergamo alone, 25 priests have died. What I want to say by this is that it is important that we remember in this Easter weekend that we are a community, and we have a responsibility to our fellow neighbors. And I will say, too, that it is heartening to me that so many churches and congregations have reached out to make their services available online in a way that doesn't endanger people. I'm also very happy to report that a recent mobility report from Google showed that statewide movement for retail and recreation locations is down 37% compared to before our public health orders were put into place. Workplace visits are also down by nearly 30%, according to Google. This data shows that more people are staying home. Last week, I also issued a directive requiring a 14-day quarantine for our out-of-state visitors and residents who leave the state for non-work-related purposes. We are asking folks to delay their visits to Wyoming at this time. Developed recreation sites are closed on the U.S. Forest Service throughout the Rocky Mountain region, as is overnight camping in our state parks. Wyoming Game and Fish Department has emailed 43,000 non-resident hunting and fishing license holders advising them of the current state restrictions on travel that require that 14-day quarantine for anyone who enters the state. And I have just this morning asked the Commission to consider suspending the sale of short-term fishing licenses simply because if you're going to be here for 14 days before you go out, it doesn't seem correct thing to do to issue temporary or one-day licenses. The email that the Game and Fish sent stated that in no uncertain terms that if non-residents cannot abide by this directive, they should stay home. And I say that because we're particularly concerned about our neighbors in a lockdown state like Colorado coming up to Wyoming or from Utah. And that message is also being shared at point of entry boat inspection stations. And lastly, I'd like to ask all of our neighbors to resist coming to Wyoming for antler collection during this spring season. Game and Fish is monitoring fishing licenses sales daily. Non-resident daily licenses, which are a good indicator for non-resident visitor frequency, are currently down 21%, so obviously it's working. While parking facilities, trails, and trailheads are open on the National Forest and in our state parks, I'm asking folks to recreate close to home and to practice social distancing when they choose to go outdoors. And we all know that means no less than 6 feet. That means if you arrive at a recreation area and there are a lot of people there, choose somewhere else to go. The safest choice is to stay local and recreate in and around the community you live in. Now I'd like to shift the discussion to our economy and the impacts of this virus on our workforce and business communities. At this time, I want to introduce Robin Cooley, Director of Wyoming Department of Workforce Services, to talk about her agency's work and the expanded benefits that are going to be available under the CARES Act. Director Cooley.
Thank you, Governor Gordon, and thank you for inviting me here today. My name is Robin Cooley. I'm the Director of the Department of Workforce Services, and it's my pleasure to be able to talk to you today about what we're doing in our unemployment claims unit in order to handle the increased load that this situation has caused in our claims unit, as well as talk to you about implementation of the Federal CARES Act and how that might impact you. As you know, the numbers are up dramatically in our claims unit, threefold and at times eightfold. But that's happening all across the country. And the interesting part about that is the number of, or the claimants that are coming in are actually claimants that have never filed claims before. What that does is it increases the difficulty that we're having in addressing those claims, because with individuals that haven't filed claims before, they don't know how to handle the process and they don't know what to do and how to answer some of the questions. In order to address some of these increased claim numbers, what we've done is we've started redeploying individuals from within our agency to handle some of the claims in that unit. We've also hired temporary staff to handle some of the claims in our call centers. But as well, we're working on implementing additional phone lines, because I know the frustration that we're hearing from individuals calling in that they either have a wait time of numerous hours, or they're getting through to a busy line, or they're simply not getting through at all. So we are also working on rerouting other agencies that are on our phone trunk for UI. We're rerouting those lines elsewhere, freeing up more lines in our UI call center to be able to handle the number of calls coming in. But we're also investigating other ways to cut down on the phone line issues. We're looking at potentially contracting with a call center out there, and we're looking at some other innovative options with using some Google spreadsheets and with outside claims takers in order to handle some of those claims. So we're working on a number of issues. We know how difficult and frustrating it is for you out there, but please be patient with us while we try to work on some of these issues with you. Another thing we're doing, though, to try to handle the increased claims numbers is we're changing our call process. What we have asked you to do is, if your last name begins with A through M, please file your claim on Monday, Wednesday, or before noon on Friday. If your last name begins with N through Z, please file your claim Tuesday, Thursday, or afternoons on Friday. We're hoping that will help to cut down some of that clog in that phone line. But as well, a number of the calls we're getting are for password or PIN resets in order to get into your claims file. What we're asking you to do, if those are the questions you have and those are the needs you have immediately, please email dwscspui.benefits@wi.gov, and I think I might have mixed that up, so let me provide that to you again. It's dwscspui.benefits@wio.gov. What this will do is if you'll provide us with your name, the last 4 digits of your Social Security number, and your phone number, we will get back to you for the purpose of helping you set up those or reset those PINs and passwords. Again, doing that will help us free up the phone calls or the phone lines to accept some of the additional questions we're getting. I want to stress that this alphabetical sorting system that we've implemented is applicable only to claims calling in by the phone. If you're able to, please file your claim online at wyui.yo.gov. Those claims can be completed at any time. You don't have to wait according to the alphabetical listings that we just indicated. And in most cases, filing online are going to be a lot quicker for you. You won't get the busy signals or the wait times, so please do so if you're able to do so. As everything we're doing provides or requires us to be flexible and just, trying these new processes to address the issue of the clogged phones and the long wait times will assist you in getting your claims completed quicker. Next, I'd like to talk to you about the new federal legislation. President Trump signed the Coronavirus Aid, Relief, Economic Security Act, or the CARES Act, on March 27, 2020. Governor Gordon immediately signed the required agreement with DOL on Saturday, March 28th, so that the state of Wyoming claimants are able to access those funds immediately for UI benefits beginning Sunday, March 29th. So Wyoming is prepared right now to accept federal funding for unemployed workers as soon as the programs can be implemented. DOL did issue guidance this past weekend on how to implement these programs, and we're actively going through that guidance in order to determine what we need to do with our program to make this happen for Wyoming citizens. I want to provide you with a short summary of the programs that we're implementing initially, and these are the programs that will be able to provide benefits out to individual Wyoming citizens as quickly as we can. The first is the Pandemic Unemployment Assistance, or PUA program. which provides unemployment benefits to those that are not normally eligible to receive benefits. That's going to be your gig workers, your contract workers, and your self-employed individuals. This benefit is retroactive to January 27th, 2020. And I want to explain to you what that means. If you can show that you were eligible dating back to January 27th, or whenever you're eligible dating back to that date after that point, once these programs are implemented, you will get benefits back to that date that you become eligible for UI benefits. So even though it's taking us a while to get these programs implemented, your claim, your benefit will be retroactive to the date that you were eligible. The next program is the Federal Pandemic Unemployment Compensation Program, or FPUC. This is the $600 per week that you've been hearing about in the news. And it's eligible for any individual eligible for any unemployment compensation program. The benefit here begins back to that March 29th, 2020 date I just mentioned. So those who were eligible for UI benefits of any kind dating back to March 29th will get this benefit back to that date, regardless of when we're able to eventually implement the program. Those are our two top priority programs in order to start getting funds out to Wyoming citizens, and we want to make those happen for you. The third program is the Pandemic Emergency Unemployment Compensation Program, or PEUC. This is the program you've been hearing about that provides 13 additional weeks of benefits added to the end of the regular unemployment benefit program. So what this means is that claimants may collect unemployment benefits for a longer period of time than under normal circumstances. Again, I want to stress to you that it's going to take time for us to implement these programs. They're very complex programs. The unemployment system itself is very complex, and we can't make this happen overnight. So we're asking for your patience while we try to make this happen as quickly as possible. I want to tell you some things that we're doing to try to make that happen for you. First, we're reviewing the DOL guidance very carefully on how to implement the program so we can implement them appropriately and accurately. We are coding and programming, getting ready to code and program our UI systems as they relate to each one of these individual programs. You should know that in November of this year, we launched a state-of-the-art UI program. So we're very fortunate to have that in place, but it still requires coding and programming in order to make these very complex systems work within that existing system. We're also working with a number of states in a state consortium to help with this process. So we're all sharing coding and sharing some of the best practices in order to make this happen as quickly as possible. We also have current coding in our system, though, that we think can potentially just be replicated for that PUA program, so that might help us get that online a little quicker. If I were to give you a timeline right now, what we're shooting for, and no promises, but we're hoping to make this happen the last week of April, somewhere around the weekend of April, starting this, April 27th, make it somehow happen that week. If we're able to do it quicker, we'll get that on social media and make sure that you are aware of that. And we will update that timeline as we go forward and get some better ideas on the timeline for this. I would also like to talk to you about businesses in general in Wyoming and what we're doing for them as it relates to workers' compensation and unemployment taxes that may be due. We know a number of you have concerns about your experience rating. We have the Attorney General's office looking at that issue. At this time, it may take legislative action, but we are looking at some creative ways to help make that happen. So with experience ratings, please stay tuned. We'll provide more information on that later. As it relates to workers' compensation and unemployment insurance taxes that are due, as you know, the first quarter of 2020 reporting for work comp and unemployment insurance taxes will remain due the last day of the month following the end of the quarter, which is still April 30th. However, with work comp, what we're going to be doing is any interest or late file penalties that accrue from Q1 of 2020 reporting that are related to or a direct result of COVID-19 will be considered for write-off if the employer sends a written request with evidence of that information. Similarly, with unemployment insurance taxes, any interest that accrues from Q1 2020 reporting due to issues related to the direct result of COVID-19 will be considered for a waiver if the employer sends in a written request with evidence of that information. So we hope that that provides you with some comfort as it relates to those taxes that may be coming due. I also want to alert you to the fact that during this last 2020 legislative session, although not directly related to the COVID-19 situation, the legislature passed and the governor signed a rate holiday provision for businesses paying work comp premiums. The premium credit will be 8.33% of all premiums paid in 2019. It will be effective July 1, 2020 and can be used for premium payments through December 31st of 2020. Employers must be in good standing with the division as of June 15th, 2020 to receive this premium credit. We will be sending out a series of letters outlining more about this program and what you will need to do to qualify. But on the other side of this, that might give you a little bit of relief as a business submitting some of that information. So thank you, Governor, and I will be happy to take questions when appropriate.
Thank you, Director Cooley, and I want to give a kudos to you and your entire team for working as hard as they can. I know it's been difficult for people trying to reach out to the department just because we're slammed, and I put that in this context. The other night I heard one of my colleagues in the East that was talking about states that remained open for business, in his words. Wyoming, I just want to assure, you've heard about the number of unemployments we've had. You've heard about the surge of requests. I want to assure any of my fellow governors that we have closed a number of businesses, not happily, but because we wanted to recognize the importance of closing restaurants and the various other things we've done in our orders. And I feel my heart does go out to those that are struggling. I hear about them every single day. I hear from them every single day, and we are doing everything in our power to be able to address the challenges that are there. At this time, I'd like to introduce Josh Dorrell, CEO of Wyoming Business Council, who will discuss the assistance available to businesses and planning that is occurring as we begin to strategically think about how our economy is going to emerge from this crisis. Josh.
Thank you, Governor Gordon, and thank you all for being here. You said it very well. It is a challenging time for businesses, and the health of our families, friends, and employees definitely comes first. But the health of Wyoming's businesses is also very important. And in many cases, especially in Wyoming, businesses have been hit very hard by the effects of COVID-19. In some cases, because we've flattened the curve very well, we've done a good job of that. We haven't seen the health effects maybe that others have. And our businesses are doing their best, but they are affected. And health comes first. And one of the things that the Business Council and the Governor's Task Force has been doing is working to provide as much support as possible during these really tough times. And to that end, we're looking at not just right now and the emergent things, because those are important. However, we're looking at also the midterm and the longer term effects. And we want to be prepared for all of those, because as we emerge from this, we want to be ready for that recovery. And a year down the road from now, we don't want to have put our recruitment efforts on hold because of it and be behind. And so as we look at the short term, very urgent and emerging things, we want to also take note of those medium term and long term things so that we can be ahead when we get emerging from this. As far as CARES Act programs, those really fit into the urgent and emerging needs category. And many of those programs are the mechanics are not known. However, we do know about the SBA EIDL, or economic injury disaster loans, and the paycheck, the payroll protection program. Those two items are really important. And what we know about those is that those are immediate, those are in act, and those have been taken advantage of greatly by Wyoming companies. In fact, we don't have the stats here today, but I can tell you that since last Friday with the PPP, we have had a number of people reaching out and saying, hey, it's so busy, I'm having a hard time get through. Well, what we want to assure you is that the banks and the SBA director has been working very, very hard. And I would say that there have been some challenges, and I'm sure that many of the businesses have felt those. But we want to remember that in less than a week, banks, the SBA, and the federal government have put out a program that will probably put in hundreds of millions of dollars into the Wyoming businesses in less than a week. And so with that, there are going to be challenges. And while patience is a tough thing right now when you're struggling in your business, we want to encourage people to work with their local banks and make sure that they take advantage of these programs, but realize there's a lot going on, and we know about it, and we're working to help out. Another challenge that we know is that we're going to face, that each of these banks is really going to encounter very soon, has to do with liquidity. And while I know there are efforts being made at higher levels to change that, I know that at the local level, there's some very exciting things going on with local banks working together to help each other maintain liquidity and still stick with the regulations that are put forth to them. So I think that really shows a spirit of collaboration, and it shows that the people on the ground are really working hard to make this work and to band together to do our best to help Wyoming's economy. Now, we also know that the USDA is going to be coming out with some guidance here shortly as well, and the Congressional Western Caucus meeting with USDA Secretary Sonny Perdue is happening tomorrow on Thursday. So we expect some more guidance coming from that. Now, when it comes to the governor's task force, we've been working closely with businesses, with our other agency partners in the governor's office to really provide information to the governor as well as to those businesses out there. In fact, on last Friday, we had a listening session where nearly 400 people showed up to listen in, to dial in, and learn more about the PPP and also the Families First Coronavirus Act. And what we found is that there were many questions around those things. And what we also understand is that those are really helping to serve some of those urgent needs. And while it's not going to be a silver bullet or something that's going to solve all of the problems of businesses, it is going to provide some help during this very difficult time. And with that, what we also found is that as Director Cooley mentioned, many of the businesses that we are talking with have never reached out for assistance. I think that's also a Wyoming quality. We are very self-sufficient, and we tried our best to solve problems on our own. But at a time like this, I want to encourage people to reach out to their Wyoming Business Council regional directors, as well as the Small Business Development Center directors in their communities, and ask for that business help. Because what we're finding is that those folks that really need assistance can get it from the SBDC as well as the WBC, and understanding how those programs can work, and also understanding how to best run your business in this time of crisis, a little extra help goes a long way. And so that's going to help us not only in the short term, but also develop programming and make sure that we're developing education that will help the most in the future. I guess that takes us to recovery, and really not to diminish the tough times that are ahead of us in the next few weeks, but we need to be prepared for recovery, because it's not going to be just like a light switch. So we're putting together plans right now so that businesses can effectively recover, and also realize that not only does it take the business itself and the public itself, but it also takes the other departments within the state government to work together and have alignment. We're actually providing guidance not based on the calendar, because we don't understand the timing of things. But what we do know is the stage that the virus is in and how it's spreading. And because of that, we can put guidance out that is based on that stage rather than based on the calendar. And that's going to help businesses plan for the future and for the recovery. So taking those different levels of guidance into consideration, we'll be putting a plan out that will work with not only the other agencies within the state, but also within the municipalities and the chambers of commerce around the state to make sure that there's alignment. Because there's nothing worse than saying, hey, we're open for business, but there are other regulations that might be at risk, or there might be other municipality rules that you cannot avoid. And we want to make sure that we're in alignment there. And so we'll be working very hard on that recovery phase. It's an important part. The other thing that with recovery is going to take, again, I think a concerted effort and people to have some patience, as well as people making sure that they're paying attention to those guidance orders that are coming out so that we can have this done effectively. And then finally, when we all move past this and as we work through recovery, we still want to be focused on recruitment. And we're doing more of that now. Clearly, we're doing less travel, and we're not doing the conferences that we've done in the past. However, our team is still looking to recruit businesses and to show the great things that Wyoming has to offer. And really, right now, our sparse population and beautiful locales might actually be more attractive than ever before. And so as we look at that, we're trying to find out how to bring remote workers in later, how to make sure that companies that want to escape those densely populated areas can take advantage of what Wyoming has to offer. Those efforts will not stop because we know that it can't just be about today or yesterday. It's got to be also about a few weeks from now, a few months from now, and down the road in the coming years that's going to help Wyoming's economy. Now, this is a super tough time for businesses around the state. As Governor Gordon mentioned, we hear about it every day. And it's very tough to hear your friends, your neighbors, and the tough times that they're going through and their businesses are suffering. But we've also seen some very creative ways to help keep businesses afloat. We've also seen businesses band together, not just to save their own businesses, but to help their communities. And while we know it's going to be challenging, I feel like we're going to emerge in a much stronger position than we've ever been. So the Wyoming spirit, I look at it as very ingenious, self-sufficient, and community-driven. And I think that this crisis is really showing that. And the Business Council is happy to be part of it. And in terms of questions, as Director Cooley mentioned, I'll be happy to take those after Governor Gordon. Thank you.
Thanks, Josh. And I think the important message about recovery and how we're approaching that and the work you've put into that, along with your fellow task force members and the other task force as well. Let me just say that one of the things is there are so many great ideas that are coming out of these task forces that we have put under the Secretary of State Buchanan's tutelage, the sort of resourcing of all of these efforts so that we know where we are on the page as a state every given day. I wanted to make sure the people of Wyoming understood that because Secretary of State stands second to me. I have a face mask here that was delivered to me, and I haven't learned how to talk through it yet, but I do wear it. But I want to make sure that people understand that should something happen to me, which I am very concerned about, the possibility of anybody in our command structure being laid low by this very virulent virus, that we have a chain of command that's effective, doesn't lose a beat, and keeps going. Before we take questions, I want to reiterate that in consultation with Dr. Harrist, I continue to work with her to make adjustments to our statewide approach to protect the public health. Just Monday, in a telephone or a television conference with the president, Dr. Fauci had this to say after repeatedly saying that every state should have a shelter-in-place order. He said, "I've had good conversations with Governor Pete Ricketts and Governor Kim Reynolds, and it's interesting that functionally, even though they have not given a strict stay at home, what they are doing is really functionally equivalent to that. I've had conversations recently with Governor Ricketts, Governor Reynolds, Governor Nome, Governor Bullock of Montana, And I want to just emphasize that as a region, we are looking at ways that we can share resources. We are looking at ways that we have adequate staffing, adequate facilities for medical conditions should they continue to be a challenge. I am really delighted that as governors, we all work together. We constantly try to monitor what's going on in each other's state. And I'm really happy to report that we do have that sharing of perspective. Let me just say, lastly, just to reaffirm, if you're hunting sheds and you're from out of state, don't come unless you plan to be here 14 days before you start hunting those sheds. Let me finish by saying we should all be staying vigilant, not relaxing our commitment. I know it's hard, particularly as the weather's getting better. But we need to stay at home and avoid gatherings. We need to minimize our trips to the store. We need to keep the size of our gatherings to a very small level. We need to constantly wash our hands. Dr. Fauci recommends washing your hands 50 times a day for 20 seconds. Josh has talked to you, and I certainly recognize the economic impacts of COVID-19, and they become more visible as time goes on. I want to say how much I really want to express how proud I am of the First Lady's efforts to make sure that people in Wyoming, the Food Truck of the Rockies and the Hunger Initiative have visited a number of communities and fed hundreds of people. This is what Wyoming does. We come together in times of need. We support neighbor to neighbor. The danger this virus presents is very real. Nobody's making any light of that. But I also want to commend the people of Wyoming for standing up and doing what needs to be done. You've limited your travel. We're seeing that in those data. We have fewer people on the road. We have smaller gatherings. These are all positive signs. And I believe by continuing that commitment, we will be able to further address this public threat, and we will be able to move our state forward to a place with a strong recovery. And with that, I have opportunities for questions. There's one that was submitted prior to from Angus Thurmer of Wyofile. It says the General Duty Clause of the Occupational Safety and Health Act of 1970 requires employers to furnish to each worker employment and a place of employment, which are free of recognized hazards that are causing or are likely to cause death or serious physical harm, end quote. What does this mean for workers in grocery stores, miners on a bus, construction workers carpooling? Must the employer supply them with masks or pay for their mileage so they drive to work individually? Director Cooley, do you want to take that?
Yes, thank you, Governor Gordon. We've been getting those types of questions into our OSHA unit, and we've been discussing them with our state occupational epidemiologist, Meredith Toll, as well. Those are questions we take. They are questions and complaints that we investigate. There are a couple of those that we're looking into right now, but I would also like to direct you to our website where we have a number of business and OSHA guidelines that are in there that I think can probably run down the requirements better than I can here. So it is an issue we're looking at and an issue we're addressing actively. Thank you, Governor.
Thank you, Director Cooley. We're going to try, we've been trying to get our communication skills in this new Capitol up to speed. So hopefully the phone lines are working, and we'll see how that goes.
Governor, this is Seth of the Star Tribune. Can you hear me?
Yes, I can, Seth. Thank you.
Can you, you talked a little bit on Friday and sounded pretty frustrated about FEMA diverting shipments. Can you talk a little bit more about that and what happened there?
Well, I think, Seth, thank you for that question. It's about whether FEMA is diverting shipments, and I think every state in our region, and in fact, almost every state is running into this. As you know, supplies are coming in. Operation Airbridge is bringing supplies from overseas and then distributing that to private companies that we're then supposed to go reach out to see if we can get those supplies. And what we're finding, what we've found, what other states are finding is that often, unfortunately more often than any of us would like, those supplies are being diverted by the federal government. And I have to say this, I mean, it's absolutely true that places like New York, we see it every day. We see the number of deaths they have. Their need is true. My heart goes out to them. But in the process of making sure that we get all those supplies to the hot spots that might be emerging in Louisiana or elsewhere, that we not forget places like Wyoming, Montana, North and South Dakota, Idaho. And so it is terribly frustrating. It's something we've brought up over the past couple of weeks on White House phone calls. It's something I spoke to Vice President Pence on earlier this week on our conference call. The critical supplies of PPE and also testing supplies. Thank you. Next question. Just
to follow up on that, if I can, real quick. So are these shipments that Wyoming had paid for, or that we were receiving, from FEMA and hadn't paid for?
These are orders that we had supplied and put in the stack. I cannot speak, Seth, to whether we had paid for them or not. I know that they were confirmed orders that were supposed to come our way.
Okay,
thank you.
This is Bob Beck at Wyoming Public Radio. I had a question for Dr. Harrist, if I may.
Absolutely.
I heard you say, Dr. Harrist, that you're going to try and start listing some of the probables around the state. A question that we constantly are getting asked and see is that, is this a lot bigger than the numbers that we're seeing coming out as positive tests? Could you maybe comment on what you suspect is out there?
Sure. Thank you for that question. I can't give specific numbers on what I think is out there, but I think, and we've been saying for several weeks now, that we know that there are more cases of COVID-19 in Wyoming that we've detected through laboratory testing, because we know not everybody with compatible symptoms can get a test. And in terms of our Wyoming Public Health Laboratory, if providers are sending samples to us, asking them to prioritize specific types of patients who are more severely ill, who are healthcare workers, or who may be more at risk for severe illness, such as older people and people with underlying medical conditions. So yes, there are certainly more people in Wyoming who have COVID-19 that we're going to be able to detect through laboratory testing, or even through identifying probable cases, which again are symptomatic close contacts of laboratory confirmed cases.
Are you getting the sense that there are some areas that, I'll use Albany County since where I'm sitting, that have, I think, listed 4 or 5 cases, that it's a lot larger in some places like that?
A lot larger in places that maybe only have a few cases right now?
Right.
Okay. Yeah, and some of that we can look at, by our case investigation. So during our case investigations, and this is on our website, I identify what may be a potential source of infection. And so we can, and in many cases, we can identify specific clusters where we know that certain people were exposed to others and have a good idea where the source of infections are. That's a different situation than when we're identifying cases who have, again, there's no readily identifiable source, seem to be going about their daily business and developed COVID-19, and that's an indicator of community transmission. So there are certainly indicators in several areas of Wyoming that community transmission is occurring, whereas in others we're really, again, able to identify clusters of cases with identifiable sources. So it is variable throughout the state, if that's helpful.
Thank you.
This is Mark Bentley with 307 Net Radio in Buffalo. I have a question for Dr. Harrist. Dr. Harrist, you have stated, or it was stated earlier, that several thousand new test kits have been sent out around the state. The bottleneck, however, seems to be in getting them dealt with at the medical in Cheyenne, where they're to be checked. Is that true, and how is that going to be dealt with?
I'm sorry, could you repeat that question? It was a little bit, could you speak up a little bit? Thank you.
Yeah, I'm sorry. The new test kits that have been sent out around the state were used by the local hospitals and other medical people. How is that going to relate to the amount of testing that's available in Cheyenne at the Department of Health?
So the question is, testing that could be set up at hospitals around the state, how would that compare to the testing that's currently done at the Wyoming Department of Health? Did I get that right?
Sort of. Do you have the capability to do significantly more tests at the Department of Health?
Yes. Okay. Thank you. Sorry for that. So we have some limiting factors, and that right now are factors that are somewhat out of our control, in that specific reagents we need to do the testing are in short supply across the country. Essentially, all the states need them to do the testing. And so, we put orders in and we get small shipments of them that are able to keep us going for days to weeks at a time. But that is why we're asking providers to prioritize samples that they're sending to us. In terms of increasing the efficiency of the testing or the throughput, we do have ways to do that and have plans in place to do that. But unfortunately, because these certain reagents which we need are limited, are unable to do that at this time.
Thanks very much. Is there another question?
Sure, Governor. This is Tim O'Reilly, Bigfoot 99 Radio. I was wondering if you could talk a little bit about, I know you probably have information, and Dr. Harrist doesn't want to talk about specific numbers, but I'm sure that you have some information about when you see the caseload peaking in Wyoming, beginning to taper off. And I wonder if you have looked ahead to create a plan about how you will begin to lift the public health order. If that will begin statewide, as they would expect, or will begin to lift the orders community by community or business sector by business sector. Have you had a chance to look ahead to a plan of lifting the public health orders?
Yeah, sure, Jim. Thank you very much for that question. Let me take a little bit of a spin on it, and then I might turn it over to Dr. Harrist and to Josh, who both have pieces of that question, which is, how do we begin to think about lifting these orders, and what looking ahead, what is our notion of the peak? As a result of communicating with my fellow governors, it was brought to my attention that North Dakota yesterday, on one of the healthdata.org, the IHMS site, which is what the White House has used, and a number of others, was indicating that North Dakota had 29 actual deaths. In fact, North Dakota had 4 deaths at that point. And that is not a criticism of the model. It just is a factor of models. Models are inherently dependent on the data that they get. And in our case, in Wyoming, we were unclear that we were getting accurate numbers of data. Dr. Wheeler, when he was down here the other day, was pointing out their concerns, the Wyoming Medical Society's concerns with that particular site, because it didn't seem to have the right number of hospital beds. And yet that seems to be, one of the big predicting models that we all are paying attention to. My point here is that the data that are coming in is noisy. And so it serves as a sort of general indication of what we might see. And as those models are run, and we've been trying to get our Department of Health in contact with IHMS statisticians But the point is that as those models are run, they change. We do believe that our efforts to date have pushed the peak out a bit. And I'll let Dr. Harrist talk a little more directly about that. But I just did want to point out that as much as I would love to say there is a specific day and a specific time when we will see the peak, that remains a little occluded at this point. Dr. Harrist?
Thank you. And I do think, and I think I said last week too, that certainly, where we are on the curve is an indicator of when we may be able to come back on some of the state public health orders if we're confident that we're, seeing a decreasing number of cases every day. Certainly another factor would be what our hospital systems are looking like. Do we still have capacity? Are our beds full? Are we able to care for the patients that need care? Certainly that would be a factor in those decisions. And then whether, we would do that on a regional versus statewide basis, I think those things are both things to consider depending on what we see going around the state. Although there is, I think, some importance in acting in a uniform way across the state, since we know that people do travel between counties for work or shopping or relatively frequently.
And then, Jim, let me invite Josh back. His task force has been looking, again, kind of at reemergence.
Our efforts there have been centered mostly around the logistics that will be required of businesses during those different phases, because as you all know, if you're being impacted by this in your business or as a customer of the business, we know that the logistics around that are a little bit dicey, and it takes people time to recover and to put those logistics into place. So ours is really around planning, not only how do you interact with the public, but also how do you interact with your supply chain to make sure that those things are ramping up slowly and then being able to go as the market allows. And so really, again, focusing on the planning aspect. Businesses love to be able to plan, and uncertainty is the name of the game right now, and that's tough for businesses. So we're working to really help get those planning parts in place so that you can handle the logistics.
And then lastly, Jim, just to sort of come back on the model piece of it, a lot of models concentrate on numbers of beds. I think we've explained a couple of times that beds are a concern in Wyoming, but not as big a concern as the people who are running them. So let me just say a word of support and thanks and kudos to the folks at Sage West in Lander and Riverton, the folks in Teton at St. John's, folks down here at CRMC. They're really taking the brunt of a very difficult set of circumstances. One of the things that the medical task force has looked at is, ways that we can give some relief to those people so that they aren't constantly in the kind of crisis condition that they are. But we do monitor that very carefully. Things like ventilators. Again, the data on ventilators is a bit noisy. Some of the but the anesthesia units can be modified. We've been looking at other technologies to be able to buttress and augment the capacities that are there, both at hospitals and then maybe some other opportunities there. So we're trying to get a real handle on those data. To be able to make sure our model is much better, but we are a long ways from out of the woods, but we are thinking about what it's going to look like when we get to the other side. Thank you,
Governor. Thank you for that thorough answer. Just one quick follow-up. You did say that you were pushing out a little bit on when the peak would come. Are we talking mid-May now?
Dr. Harris, do you want to try to take a shot at that?
And, there are a lot of models out there, and it depends which one you look at, where it says that Wyoming's peak will be. And so I think it would be, I don't want to say I think the peak will be mid-May. I think it's too, we don't have enough certainty in that to be able to reassure people that that will happen. What I think we have done is through the public health orders that we've written, flatten the curve, as everyone says, which does mean pushing the peak out a little bit so that we can make sure that patients are coming into our hospitals at a rate that they can be taken care of. We are looking at a variety of models, some of which do have the ability to incorporate Wyoming-specific parameters and assumptions. We're also using our own data to look at where we are and using and refining our estimates of Wyoming hospital and healthcare system capacity to make them more useful as well. So I think we've pushed the peak out, but I think we'll just have to keep monitoring the data that we have both in our healthcare systems and in our epidemiologic systems to know when we're going to reach that peak, when we've reached it, and when we're starting to come down.
Thank you.
Thank you. Any other questions?
Governor.
Yep.
Governor Gordon.
Governor Gordon.
Barbara Ann from Bighorn County.
Hi, Barbara Ann.
Hi. Thank you guys so much for adding the additional statistics. I do have one question for you. There are some people that have reached out that are from Cheyenne that are concerned that the state employees are still coming into the state from Colorado, from the hot spots. I'm just wondering, is there any plan to address that, or are you taking special actions to make sure that they're not bringing anything as they travel from home to work?
Barbara Ann, you point out an important issue, and it's not only at the state, it's also at the Air Force. There are people that live in northern Colorado, and we have been fairly direct in suggesting that they take additional precautions. You'll note that my quarantine order really talked about coming into the state for non-work related reasons. So we are monitoring people on a daily basis. Again, same advice that we've given in the past. If you feel at all ill, please don't come in. And we have really expanded, and I want to thank Director Cooley and also what we call our enterprise technology services for standing up really what kind of surprised, I think, all of us how well it's worked, telecommuting. So as much as we can, we're making sure people stay away. We've tried to implement procedures in the lobbies of some of our agencies so that people can come in and have access, let's say, to a phone or to a terminal of some sort. But we're really trying to make sure that the public access is somewhat limited, and then really relying on our workers to take care of themselves.
Thank you.
Thank you. Next question. No, and thanks for the lovely verses you send me every day. It really is uplifting. Thank you. Next question.
You're very welcome.
Governor Gordon, this is Billy Arnold from the Jackson Hole News and Guide. I have two questions about funding for unemployment programs. The first is, how much does the state currently have in its unemployment fund, and is it enough? And then the second is the Family First Coronavirus Act, not the CARES Act, but the one that came before it, could see Wyoming allocated two payments of about $900,000 for the administration of its UI program. And is Wyoming pursuing that funding? If not, why not? And if so, what is that funding going to go towards?
I'm going to turn that to Director Cooley.
Thank you, Governor.
Thank you.
As it relates to the UI fund, I don't have that figure right in front of me, but I can tell you at a state or a nationwide document that I just looked at this morning, as of January of 2020, our unemployment insurance trust fund was the third healthiest fund in the country. We are working with another national organization today, actually, to look at some of the modeling with some of the claims that we've had in order to ensure that our trust fund will be healthy throughout the term of this situation. But I feel very comfortable where we started with that fund, as healthy as it was. And I can tell you, we can get a number out there. I think, it's public knowledge, and we'll get that number out there in the public on our website if that would be beneficial. You also referred to the first funding stream that came from the federal government. We actually did take full advantage of that funding stream. That unfortunately, that money is not for UI claimants. That money is actually for administrative costs for our agency to try to ramp up to administer the increase in funds. The first part of that funding stream comes whether you do anything different or not. And so that first part of that funding stream will come into the state very easily. The second part of that funding stream actually comes in after we do a few things requested by the Department of Labor. And one of those things is that we relax our work search requirements for some of our individuals that are applying for unemployment insurance that have found themselves unemployed through no fault of their own and based only because of this COVID-19 situation. We worked very closely with our Unemployment Insurance Commission, who is actually responsible for the unemployment rules. They worked very quickly with their Attorney General, and we have emergency rules in place in order to relax that work search requirement so that we can start accessing those funds. So we're fully on board with that. We're ready to access those funds as quickly as we can. And yes, we did take part in that to the full degree. Thank you. Thank you, Governor.
Got it. Thank you. And just as a follow-up question, what currently is the status of work search requirements in Wyoming, and what is the work search requirement for people applying for UI at this time?
The work search requirement is if I can get it straight here in explaining it, if you are accessing unemployment insurance benefits because you were unemployed prior to the COVID-19 situation, you are still required to do a work search. And I believe you have to show that you applied for or were looking at least twice during the week, each week, applying for jobs, because there are jobs out there. There are businesses that do need employers or employees. If you are unemployed as a result of the COVID-19 situation, that work search requirement is waived because in most instances, and the hope is certainly that you're unemployed with a business that is going to open up on the other side of this, and when we can actually open the state up for business. So those individuals are what's called job attached. So with that job attachment, that work search requirement is waived. Did I fully answer that question?
Yes, you did. Thank you.
Thank you.
Yeah, and thank you for that. Just want to follow up quickly on that too. Just by way of information, we have been, our office and the task forces have been working with the legislature. As you know, there could be a special session at some point, but we want to make sure that we have legislators that are prepared. And one of the possibilities is there's a program that Director Cooley referred me to called Work Share, where if, let's say you're working 40 hours a week and you've been reduced to 30, our particular problem is we don't have a provision in our law that allows for you to make up that difference. So we're going to work with the legislature to see if we can amend that feature. And then I also wanted to just point out that our workers' compensation fund is unbelievably healthy. The efforts that we undertook a couple of years ago to what's called tenor matching, making sure our obligations match with what we expect the actuarial demand to be, are properly matched, and we've really done a good job there. So next question.
Hi, this is Josh Wilson of the Casper Star Tribune.
Yes.
I have a question for Dr. Harris. To date, Wyoming hasn't experienced a COVID-related death, and of course, we're the only state to not have a death at this point. Is that a function of anything we're doing here or a circumstance here, or is that a function of small sample sizes?
Thank you. I mean, the bottom line is I don't know. I think that, the virus is as serious here as it is anywhere else. Unfortunately, I do expect that we will see deaths in Wyoming from this virus, which is why we're taking it so seriously. I know that, we have had several patients who have been extremely ill but have received great medical care and have recovered, which is excellent. So I don't think I can really speculate on the reason. We're, of course, a smaller state. We do expect to have fewer cases and deaths than other states, just simply for that reason. I certainly hope that it continues, but unfortunately, we know that this virus can be especially serious and deadly for some people.
Thank you.
Yeah, thankfully, there's a lot of wood in here. I'm going to knock it.
I've got a question for Dr. Harrist. This is Angus Thurmer from Wildfile. Are pathologists and coroners testing people who die to see whether their death may be related to this virus?
Yes, we are aware of pathologists and coroners who have tested, who have taken post-mortem samples from people who died with symptoms or findings that could be consistent with coronavirus, and so far the tests have been negative.
Next question.
Hey, this is Andrew from Wildfile. I'd like to follow up on that OSHA question from the beginning when you guys started taking questions. And you talked about guidances for the employer on OSHA. I was wondering if the governor, if you have any message or guidance for those workers in retail or construction, even office workers who are unable to follow the directives to stay at home because their place of employment is still open and their employer expects them to show up.
Thank you, Andrew. We've continually pushed to make sure that stores do their best to protect workers. Reportedly, Menards has not done a particularly good job here. There have been crowds assembled at checkout lines and other things. Lowe's, on the other hand, has taken some precautions. I needed to go out to PetSmart the other day, and only 10 people are allowed in. All the staff were wearing masks. They requested that people wear masks. Albertsons and King Soopers down here are now delivering groceries to your car. I think we are adapting. I would continually encourage. I think there are heroes and there are zeros, and I continue to encourage people to shop at the places that they see the heroes, the ones that take care of their workers, and the zeros they can avoid, which will solve the problem both ways. One, people won't frequent stores that don't take those precautions, and two, they'll reduce the crowds at those stores.
Do you reach out to some of those bigger employers, like some of the ones you just talked about, or?
We have, and I will say, you'll note, Andrew, that I made some comments about particularly Walmart over the last, about a couple of weeks ago. I'm happy to say Walmart has responded, indicating that they're doing the very best they can to make sure that that both their workers and their clientele are better protected. We have been reaching out. I'm also encouraged. We have a legislative call once a week, and one of the issues that came up was how railroads were handling workplace situations. And I'm happy to say both Burlington Northern and UP responded with increased diligence for their workplaces and workers.
What about some of the smaller businesses, smaller employers all over Wyoming? Is there efforts being made to reach out to them as well, or ways that you can drive that message home, I guess?
Andrew, for some reason you're breaking up, but you're talking about smaller employers, and I would say that some of our smaller employers, and maybe Josh can speak to this, have really taken this opportunity to address perhaps what might for at least a somewhat extended period, even if we are able to come out of this, still may want to maintain some social distancing in our workspace. And there are small businesses that are really doing an extraordinary job of limiting the number of workers that are in proximity to one another, making sure they have extended areas in between where their workplaces are, and scheduling at times as well. So, Josh, anything you want to add to that? Oh, thanks. Thanks, Andrew. Time for two more questions.
Governor Gordon, thanks for your answers before. This is Billy Arnold again from the News and Guide with a separate question. The other day, Senator Barrasso talked about Wyoming's existing social distance to defend not issuing a statewide health order. But while the state has a population density of about 6 people per square mile, more than 20% of the population lives in cities or dense towns where density is greater than 2,000 people per square mile. And I'm thinking of Jackson, Cheyenne, and Casper there. And I guess if you're not open to a statewide stay-at-home order, why not give communities with high population density like Jackson more and less social distance, more latitude to pursue one of those orders themselves?
So if I understood your question really as, I think Senator Barrasso on Fox News the other day was really talking about Wyoming and Wyoming doing the right thing, and how we had a few number of people per square mile. And I think your point is that there are some communities that are much denser than that. That's true, I think, through the Intermountain West. My friend, Governor Bullock of Montana, speaks a lot about Gallatin, which has many of the same issues that I think Teton is experiencing now. And what we have maintained from the beginning is, as counties feel it's important, and it's important to understand the jurisdiction there, as counties feel it's important, they can come to the state. Dr. Harrist and I will work with them to craft an order just like the one that is in Teton at this point, to recognize the unique circumstances that higher concentrations could be. But what I do want to say, and as we look at these models, it goes back to the modeling thing, there are assumptions that are laid into models, and one of them is if you put a mandatory state stay-in-place order, then there are all these things that are supposed to go with that, and that affects the way the model runs. If you don't have a specific statewide stay-in-place order, they don't click that toggle when even, and this is what we're trying to work with IHMS, even when the bulk of our order is everything that would be carried under that statewide stay-in-place. For example, if you look at that order, you will see that it says we haven't closed businesses down. Clearly we have. Those are the kinds of variables that go into the modeling exercise that make it informative but not precise. And so just to come back to your point, we're happy to work with counties as they see fit to make sure that their needs are well met. But generally across the state, we're seeing a decrease in activity. We're seeing people socially distance. Our lockdown state to the south, Colorado, the one where nobody's supposed to be traveling, seems to be traveling in droves up to Wyoming. We're trying to put a stop to that. And so, we're doing everything we can to make sure that Wyoming is taking all the precautions that it can to make sure that our population's safe and that we don't exceed our medical resources.
Thank you, Governor.
Thank you. One more question.
Governor, this is Bob Beck again at Wyoming Public Radio. Wanted to ask you just a little bit about those who are renting and have landlords and tenants. I know you've talked a little bit about asking folks to be flexible there, but have you thought about taking it another step or seen the need yet to take another step about suspending anybody from evicting folks for not paying rent or being able to pay rent at this time?
Bob, thank you for that question. It's one that's very much on my mind. Been working with WCDA, the Community Development Authority, to figure out any ways that we can address those issues. The business task force that Josh is a part of has spent a tremendous amount of time on trying to figure out how folks can work with banks to, sort of extend that. We are looking at every avenue we have to be able to relieve that pressure. I have mail unhappily more often than I would like that says, you put me out of, by closing the business that I worked at, you've now put me out on the street. Thanks, Governor. That's really great. And I feel horribly about that. So we are doing everything we can, Bob, to try to address that in any way that we possibly can.
Is there anything you can do with an executive order or anything like that? Is that
yeah, thank you. I think the question was, is there anything in an executive order that I can do? I have had conversations with Attorney General Hill about what are my what is my latitude there? What are the things that I can do? And I would say stay tuned. We've been working on every legal avenue we can.
Thank you.
Thank you, Bob. Well, with that, I want to thank you all for being here. And I hear from friends of mine who publish newspapers, who run TV and radio stations. And I know this has not been missed on you. I know you, the reporters, that we count on to make sure that our information is accurate and direct and gets out to the people. You're feeling this too. And believe me, thank you from the bottom of my heart for the service you render to the people of Wyoming, for the diligence with which you pursue it, and Godspeed. We all arrive on the other side, and just one more note of thanks to you for being here. Thanks.